Hey everyone, Michael Doyle here. This is going to be a quick update on non-narcotic pain management. Primarily, we're going to be talking about acetaminophen and ibuprofen, and the cousins, the IV formulations, IV acetaminophen and ketorolac. All right, so let's start with oral formulations. You have two options for pain management in the pre-hospital setting here. You have both acetaminophen and ibuprofen. We'll talk primarily about pain management today. However, remember that these can also be used for fever and are very effective at pediatric fever. Just take a look at that if you're curious, but essentially you can enter this fever pathway if you're having a fever of greater than 38 degrees Celsius, which equates to 100.4 degrees Fahrenheit. These are very effective medications in pediatric patients for fever, but it is weight-based dose, so make sure that you take a look at the weight-based dosing in the protocols. So if we jump over to pain management and we take a look at the both adult and pediatric pain management protocols, we see that we should consider both of these for pain management as long as the patient's not altered, as long as they have a good blood pressure, and specifically for the oral formulations, you have to be fairly confident that they're able to tolerate oral intake well. So if they're not alert, you don't think that they're going to be able to swallow effectively. If there's any concern about their respiratory status, I would certainly hold off on any oral formulations of these medications. The dosing is fairly straightforward. For adults, we're going to give 1,000 milligrams, or actually it's going to be up to 1,000 milligrams of acetaminophen and up to 400 milligrams of ibuprofen. Please, again, reference the dosing chart for pediatric dosage as it is weight-based. Big contraindications to these medications, of course, are going to be if they have any history of allergies to them. In the setting of acetaminophen, we have to be cautious that we're not overdosing them. So we're going to give, this is a medication that's frequently given at home. So if they've had either one, acetaminophen or ibuprofen, within the last 6 hours, you should not be giving another dose in the ambulance. Of course, if there's a concern for overdose, this happens frequently in some of the patients that were concerned about their mental health. If there's any concern of overdose on Tylenol or ibuprofen, we should absolutely avoid those medications. Specifically for ibuprofen and for ketorolac, the IV formulation, we should be avoiding it in patients that are on blood thinners. So we're talking about warfarin, Coumadin, Eliquis, Xarelto, things like that. We should also avoid it in pregnancy. And then we should also avoid it if they have any sort of severe renal disease or renal injury, especially if they're on dialysis. Okay, so that brings us to the IV formulations of these medications. So these are available at the paramedic level. The equivalent to ibuprofen IV is ketorolac, so that's a similar NSAID or non-steroidal anti-inflammatory medication. The dosage for that is going to be 15 milligrams. That can be given both intravenously and intramuscularly. This medication also is kind of generally called Toradol. You may hear that as the brand name. This medication is going to be administered as a slow IV push. As far as the IV acetaminophen goes, that typically comes in a formulation of 1,000 milligrams of acetaminophen in a 100 milliliter bag. This is best to be administered relatively slowly, so you're going to think about over 15 or 20 minutes. One of the side effects that we've been noticing with this medication is transient hypotension. And this is interesting because we give people oral Tylenol all the time and don't see this. It's theorized that the IV formulation is causing hypotension because it's bypassing the liver. So when you take an oral formulation, your intestines absorb it and it passes straight through your liver, which can start its metabolism. Whereas if you're giving it intravenously, it's metabolized partially on the endothelial cells, the lining of your blood vessels, and it can be metabolized into an alternative metabolite that's going to cause some transient hypotension. So that's why we see it. It's kind of an interesting theory. There's a couple of papers that discuss this. One by Kim et al. Notes that hypotension can be between 8 and 59% of patients that are administered. This was in an ICU setting, so these are fairly sick patients. However, you're also dealing with very sick patients in the pre-hospital setting, and oftentimes you have very limited knowledge about what's going on with them or their underlying physiology. They also noted some trends, and they saw that patients that were on beta blockers or were very ill with septic shock were more prone to this transient hypotension. The best way that we can prevent this is really to be diligent about who we're giving IV Tylenol to, and to administer it, like I said, over a slow 15-20 minute infusion. Of course, we can treat these side effects if they do occur. So remember that there's multiple tools to treat hypotension that include IV fluid resuscitation and pressor medications as needed, such as norepinephrine. I don't want this to necessarily scare you away from using IV acetaminophen. I think it's an excellent medication. It seems to treat pain very well. People often say that it's more effective than an oral formulation. However, we haven't really seen that proven in studies yet. And when we're considering other medications, we're also talking about things like IV morphine or IM morphine, fentanyl, ketamine. All these have really more profound effects on hemodynamics. So as far as the risk of hypotension goes, I would say that IV acetaminophen is much lower than, say, compared to IV morphine. So just keep this in mind as well. We should absolutely not be administering anything like IV morphine to patients who are hypotensive. If you do see some transient hypotension with acetaminophen, the first thing I would recommend doing is stopping the infusion. If you think the patient can tolerate some IV fluids, I would start with a gentle fluid bolus of about 500 cc's of saline. And if you get into some more trouble with some more severe hypotension, that's when I would consider starting a norepinephrine infusion and probably talking to medical control at that point about next steps. Remember that you have a lot of tools in your tool bag in the pre-hospital setting for treating pain. You should be thoughtful in which medication you choose and why you choose it. I think it's always a good idea to consider oral formulations if you think the patients can tolerate it. This is especially true for your pediatric patients. Ibuprofen and Tylenol work really well in this population, and really should be your first go-to. None of these medications are really without side effects, so be diligent about what you're choosing, know the potential side effects, and make sure that you're monitoring for them and treat them if they do occur. If you do have any instances where you see hypotension related to IV Tylenol use, let us know. We'd be interested in looking into the case and studying it a little bit further. As always, please reach out to us if you have any questions. We're always happy to talk about your cases or any questions that you may have.